Minister, are these staff members teachers, first of all?
They are, and I'd just like to thank the head teacher and the senior leadership team at St Ninian's High School for the work they've been doing over the weekend with the track and trace team. This is just to do with the high school. There's no links to the lower school with younger children. And we've got one member of staff who did the right thing, came forward, was tested and unfortunately found to be positive. Now, what the track and trace team have been doing is working right the way over the weekend to see where there are any further links. As you said, we've got 6 other members of staff who've been tested. They're all negative, but they're all self-isolating. And this is the sort of thing we thought we would get sooner or later as we start opening the borders and as Manx residents start being able to come backwards and forwards to the UK more freely. So there's no obvious link to students. The track and trace team have finished all the key contact tracing they need to do, but the message is there that we're encouraging parents and pupils to do the right thing, to consider wearing a face covering. We're going to have masks there if they want to wear them. I was on the show only a week or two ago in terms of lateral flow tests. We're going to get more of those available so that those people who are perhaps a little bit cautious about this can do the tests on a regular basis at home. If you have any symptoms, and this is the take-home message, if you have any symptoms, please dial 111. And that's temperature over 37.8, new persistent cough, loss of smell, shortness of breath. We need to deal with this. We're in a mitigation phase. We need to deal with this in the right way. But the school is going to be looking at indoor activities, increasing ventilation, and also looking at any planned trips. And we're going to keep on reviewing this during the week to make this school as safe as possible for all pupils and all staff.
Now, given that we know coronavirus has an incubation period of several days at least, how can you be so confident that these members of staff haven't come into contact with pupils?
They could have come into contact with pupils. You're quite right. We've got to assume that this is going to be the Delta variant that originated from India, because that's the main variant across in the UK. The incubation period of that is around about 4 days. It's quicker than the Kent variant and the ones before. There is always a slight risk there when you've got cases that arise within our community and within people who've been travelling back. So again, it's those universal precautions in terms of making sure that you wash your hands properly, that if you're unwell and get symptoms, you report and get tested. The usual thing that we've been going on about for the last year about hands, face and space and fresh air. Let's do it as a community, because as we go into the summer, as we try to get more freedom for people on the Isle of Man to go backwards and forwards to the UK, we all need to take responsibility for the mitigation actions that we do to keep ourselves and our community safe.
Now, ahead of the island's 3rd lockdown, your department told parents that it was safe to send their children to school, and a few days later there were hundreds of cases on the island. Children are unvaccinated. There are children who are vulnerable, are in at-risk groups. How can you tell parents now that it's safe to send their children to school?
Because we're doing as much as we can, both in terms of the education department, the school itself and the school staff, and as a community to deal with this virus. Unfortunately, coronavirus is not going to go away. You talk about vaccinations, and you've already talked about the statistics of the incredibly successful programme that we've got. We know that 2 doses of either vaccine are highly effective against hospital admissions, including the Delta variant. Pfizer-BioNTech, 96%. Oxford AstraZeneca 92%. We were clapping for the NHS last year. We have now hopefully broken the link between cases and hospital admissions. So now it is very much living in a world with coronavirus and doing as much as we can to look after our families and our community. But we also know the harms of closing schools down, of cutting back education. And so it's trying to get that balance between safety, but also continuing with the education of our young people to make sure they're not left behind.
Given that this situation has arisen prior to the border change that's come into force today, does it show that this is too soon to be making that kind of change?
No, I don't think it does. I think as a government, we've always been honest that outbreaks will happen. Tim Walden approved the change of the border policy so that we could start allowing Manx residents to travel backwards and forwards, so that we could start dealing with some of the social and economic effects of the very tight border restrictions we've had for well over 18 months. Now is the time, because of the success of the vaccination programme, to start opening up again, to start making sure that we as a nation can get over this and recover. So I don't think it's too soon. However, over the next couple of weeks, obviously, the Directorate of Public Health, Track and Trace and the government will be monitoring the situation incredibly carefully. And if there are any changes to that, we will respond appropriately and proportionately.